Let us talk about offensive waste, what it means, how it looks, and why it matters in our daily practice. As defined by HTM 0701, offensive waste is a non-infectious waste that may be unpleasant in appearance or smell, but does not pose a risk of infection. This includes materials contaminated with bodily fluids such as blood, urine, or feces, so long as those fluids are not infectious. These wastes are typically disposed of in yellow bags with a black stripe, commonly called tiger stripe bags. Offensive waste does not require specialist treatment like incineration, is not hazardous or infectious, must be segregated at source to reduce cost and improve sustainability. Some of the examples of offensive waste are incontinence pads and nappies from non-infectious patients, sanitary waste from washrooms, non-infectious wound dressings or plasters, PPE used in non-infectious care, bedpan liners or stoma bags when there's no infection risk. But here's the common confusion. If there is blood on an item, does it always mean infectious waste? Not necessarily. If that blood comes from a non-infectious patient in a non-infectious setting, such as a routine ward, then these blood-contaminated tissues or dressings can go into offensive waste. However, if the same waste comes from an infectious patient or an infectious area, for example, a COVID-positive room, it must be classified as infectious waste and go into the orange bag. So, how do we decide? Use your clinical judgment. Ask yourself, is the patient infectious? Is the environment infectious? Is there any suspicion of transmission risk? If the answer is yes, choose the orange bag. If the answer is no, the tiger bag is the safe and sustainable option. By making the right call, you are protecting staff, patients, and the environment, and ensuring compliance with national guidance.